Welcome to the Explainer. So, have you ever actually stopped to wonder how all that dense, peer-reviewed scientific research makes its way into the local laws we live with every single day? I mean, it definitely doesn't happen by magic, right? And it for sure doesn't happen by accident. Today, we're diving straight into that critical bridge between complex health data and real, tangible municipal action. We're going to unlock the literal science of persuasion and decode what is arguably the ultimate tool for advocacy, the policy brief. Okay, let's dive into this. I want you to put yourself in the shoes of a local city council member for just a second. Picture this. Your desk is completely buried under a mountain of paperwork. You're sprinting late between back-to-back budget meetings, and your inbox, it's absolutely flooded with constituent complaints. Then, out of nowhere, you're tasked with making a highly technical public health decision. So, as an advocate trying to reach this person, how do you actually cut through all that noise? How do you bypass the sheer political fatigue and convince this wildly busy official to actually act? Well, that is the billion-dollar question. To see this in action, let's look at a real-time example unfolding right now in Rolla, Missouri. Now, since 1945, U.S. communities have fluoridated public water, and Rolla voters actually enthusiastically approved it themselves way back in 1968. But skip ahead to late 2024, and the debate suddenly reignites over potential health impacts. In October, local dentists presented clear benefits to the council, but by December, enough members voted to actually start the removal process. With the super tight May 2025 deadline for public comments, man, this isn't just a debate about dental health anymore. It is a high-stakes communication battle playing out right before our eyes. And this brilliantly illustrates the core challenge. To win a battle like that, advocates need tools that can instantly ground a highly emotional conversation right back in reality. Look at the actual numbers. Rolla's average fluoride levels hover consistently around that optimal line of 0.7 milligrams per liter. And more importantly, they sit way, way below the hazardous threshold set by the EPA at 2.0. When political fears are running really high, deploying a stark, unarguable data point exactly like this is incredibly persuasive. Why? Because it neutralizes panic with precision. It takes a purely subjective debate and transforms it into cold, hard, objective fact. But here's the thing. Health data alone rarely sways a local politician who is managing a painfully tight municipal budget. You gotta speak their primary language, which is money. The data reveals that for every single dollar invested in water fluoridation, a community sees a $20 return in saved dental costs. Dropping a staggering economic metric like a 20-to-1 return on investment right in front of local officials, that completely changes the framing. It takes what might be brushed off as a nice-to-have health initiative and suddenly makes it an urgent, undeniable financial imperative. And we see this exact same tactical framing in national discussions too, like the ongoing debates over the Affordable Care Act and federal restructuring. Advocates across the political spectrum use really striking visual design and rapid-fire facts to distill hundreds of pages of dense policy into urgent messaging. You'll see crystal-clear breakdowns of healthcare protections contrasted right against stark warnings of Medicaid restructuring, highlighting that a $100 billion budget cut equates to the exact coverage cost of 3.7 million children. That is an absolute masterclass in translation. It takes abstract, mind-numbing budget math and turns it into an immediate emotional reality for voters and lawmakers alike. Now, let's travel over to Hawaii, where a totally different policy brief is advocating for health information technology grants to improve care for HIV patients. Once again, advocates have to ground really complex health disparities in hard, undeniable local statistics. Just look at the demographic data. It clearly contrasts the general U.S. population with Native Hawaiian and Pacific Islander communities, showing a stark jump in poverty from 12.8% to 16.8%, and similar widening gaps in uninsured rates. You simply cannot ignore the disparity when the local reality is quantified this clearly. It forces the abstract concept of inequality into a concrete, highly measurable problem. So whether we're analyzing fluoride levels in Missouri, sweeping federal healthcare funding, or digital medical records in Hawaii, a really clear pattern starts to emerge. These aren't just scientific or health issues, they are massive, massive communication challenges. The science in a lab might be perfectly settled, but hey, if that science gets trapped in thick academic jargon and totally fails to reach the people in charge, the policy ultimately fails. Which brings us to the actual, tangible tool designed to cut right through that noise and solve this exact communication breakdown. Enter the policy brief. Honestly, Think of it as the unsung hero of local government. A policy brief is this concise, highly targeted tool used to deliver vital information and evidence directly to policymakers. It acts as the critical translation bridge between the scientific researchers uncovering the data in the field and the elected officials actually passing the laws in the State House. It is literally the mechanism that gets complex health data off the spreadsheet and incorporated into actual, on-the-ground community action. But you're probably wondering, what actually makes a policy brief successful? Like, are politicians swayed more by emotional, human interest stories, or do they exclusively want cold, hard facts? Well, a massive study conducted by Washington University in St. Louis, teaming up with Civic decided to finally answer this question. They set out to uncover the true science of political persuasion by testing various policy briefs directly on the very people who read them. They didn't just guess here. They ran an empirical study on actual, real-world decision-makers. The researchers surveyed 331 local policymakers, and the demographic split really tells us a lot about the sample. We've got 64% from municipalities, 20% from counties, and 16% from townships. We are not talking about distant federal senators insulated in Washington. These are local officials, pretty evenly split across political parties. These are the folks making the granular zoning, budget, and public health decisions that impact your daily life right in your own neighborhood. Their perspectives represent the true boots-on-the-ground reality of local governance. Now, what's really interesting about this is when they were asked what they care about most when evaluating an issue, the responses were remarkably unified. A massive 92% of these officials prioritize constituent needs and local impact data above all else, while 89% look immediately for cost-effectiveness. The data overwhelmingly proves that politicians crave information that is hyper-local and financially sound. If you bring them a brilliant, globally recognized study that doesn't mention their specific zip code, you've already lost their attention. They need to know exactly how it affects their voters and their budgets. Armed with this knowledge, the researchers ran an experiment. They tested 4 different formats of a policy brief on these officials to see which was the absolute most persuasive. First up, the standard formats, a usual plain language brief and a risk framing brief that highlighted hard trade-offs. Then, they tested story-driven formats, a narrative brief centered around relatable protagonists, and a mixed version that basically combined both. So, in the epic battle between hard data and emotional storytelling, which format do you think actually won the politicians over? Well, across the board, the engagement metrics were incredibly strong for all the briefs. 87% of the policymakers found them easy to understand, and over 3/4 found the information highly believable and actively attention-grabbing. But the most impressive part? 42% indicated they were likely to take the brief and actually use it in their legislative work. These numbers essentially prove that just the act of utilizing a well-designed brief, regardless of the specific stylistic flavor, is an unbelievably effective way to capture legislative attention and drive real momentum. But okay, here is the surprising twist from the researchers. There was no dominant format. None! Whether the brief relied on plain language data, risk framing, or narrative, story-driven approach, all types were rated similarly highly by the politicians. It turns out that age-old debate of stories versus statistics, it's essentially a draw. What truly matters isn't the stylistic wrapping paper, it's that the underlying information is clear, concise, and incredibly credible. Quality execution beats format, hands down, every single time. So, the crucial point is the magic number, and that number is 7. The researchers found that policymakers were 7 times more likely to use a policy brief if it contains specific data on local impact. 7 times. Let that sink in. If you want a politician to actually stick their neck out and act, you cannot just hand them broad national statistics. You have to show them exactly how this issue is going to alter the specific town, county, or municipality that they were elected to represent. Let's move to the real world and see how this builds a winning strategy. How do we turn these academic findings into practical action? Based on this massive study, we essentially have an evidence-based blueprint for pitching any policy. Step 1. Develop concise messages using clear visual aids and rock-solid scientific evidence. Step 2. Include that vital local data. Remember that 7x multiplier? Showing direct community impact. Step 3. Know your target audience, right down to their specific district demographics and political leanings. And Step 4. Ensure every single claim is highly understandable, credible, and flawlessly accurate. Honestly, this is the ultimate masterclass in persuasion. We've seen exactly how advocates use these strategies to debate water fluoridation in Missouri and healthcare funding in Hawaii. And now, the power is in your hands. You have the empirical formula to turn complex data into actual community action, and to bridge that massive gap between scientific truth and local governance. So I'll leave you with this final thought. Take a look around your own neighborhood. What crucial issue is waiting for you to write a policy brief for today? Thanks for joining me on this explainer, and keep advocating for the changes that really matter.